Here we are at the University of Edinburgh. I got married just after finishing medical school, and then there I really worked on my PhD thesis of whether thrombosis was the cause or the consequence of myocardial infarction. I wrote the thesis, and the title was Platelet Activation Contributes to Severe Angina. Today we call this unstable angina and myocardial infarction. We developed an immunoassay for platelet factor 4 and thromboglobulin, and was very elevated from the very beginning of chest pain. And I thought this probably was some indication that the clotting system is very activated very early in acute coronary syndromes. This was at least my first, perhaps, contribution. And we decided to study if platelets are important in atherothrombosis. Is atherothrombosis diminish or decrease in these peaks with von Willebrand's disease? The results came clear soon. Platelets in atherothrombosis in peaks with von Willebrand's disease were significantly decreased. That is, the thrombotic component of atherosclerosis in this peak was decreased, pointing out that platelets are not only important in myocardial infarction, but are important in atherothrombotic disease. The third finding, aspirin and dipyridamole in saphenous vein grafts, was a lot of experimental work, but I have not seen a study like this, 70% reduction in graft occlusion by using aspirin and dipyridamole. And actually, this is the first study on aspirin on a trial. What did we accomplish here at Mount Sinai? In the bottom, with John Ambrose, the small plaques can burst in a normal angiogram and lead to a myocardial infarction. We got into HDL, and this is how the concept of reverse cholesterol transport evolved, by injecting HDL in the rabbit model and making the lipid material to disappear. And finally, we developed the first antithrombin, and then we moved into now at the Mass General Hospital. And here's where we developed the whole concept of acute coronary syndromes and natural history. Everybody talk about plaque rupture. I agree. This is a rupture plaque with thrombus formation, a plaque which is relatively small. But we thought that thrombus could also take place in very stenotic plaques. So we didn't like the term vulnerable plaque. We call high-risk plaque. And still we believe in this particular terminology. I mean, we started to do MRI, which is also part of the classification that you saw in the arterial system at autopsy. This is how we actually started imaging technology in the arterial system. But perhaps one of the most interesting findings or observations that has never been quoted appropriately is we were really responsible for the development of rapamycin and sirolimus.